With us today, Dr. Lyle Fettig. He went to medical school at Southern Illinois University School of Medicine. He was a staff palliative care physician at Eskenazi for, I think, over 16 years and has been a professor of medicine and the fellowship director for the palliative care program at the IU School of Medicine for over a decade. You can correct me. And he is currently our chief of palliative care at the Indianapolis VA Medical Center. He's been with us since about December 2023. And thank you for joining us. He's here today to talk about navigating difficult decisions and conversations at end of life. So thank you, Dr. Fettig, for being here.
Thank you, Liz, and thanks everyone. This is a brief talk about a big topic, so I'm happy to come back another time and elaborate on anything if we don't get to everything here or talk about a different topic. Liz actually gave me a bit of a promotion. I'm actually not a professor for those that keep track of these things. I'm an associate professor at IU of clinical medicine. And also, I'll just note that I was a hospice medical director for a while early in my career, and then as my educational duties kind of increased, I had to set that aside. And so most of my experience has been hospital-based palliative care within health systems, and so that's my main vantage point here. But obviously, there's a lot of overlap with hospice, and especially in the veteran population with having, the ability to do some concurrent care between hospice and palliative care and some of the disease modifying treatments such as chemotherapy. The lines get blurred, I think, in a good way. That we don't have that advantage with caring for civilians a lot of times. So I think that does impact kind of some of the difficult conversations that we have near the end of life. And I wanted to just talk a little bit about, as I think about having these conversations, I think about this from the frame of having goals of care conversations. And that's frequently how we help veterans and others to consider difficult topics like the possibility of the end of life coming, and how we can optimally bring up things that may be very helpful for them, such as hospice, and help avoid things that are not going to be helpful to them. And I think that at some point in time in our country and maybe in the world, we decided to call these goals of care conversations, but I think we could equally call them values of care conversations. It's not just about a goal of being able to do something in the future, but it's really what about people value at their heart and at their core, and how we can kind of tailor the medical plan of care to help the veterans to achieve that, with hospice being an integral part of that. So I'm just curious, given the variety of people that are on the call here, I'm wondering, and you can feel free to speak up, as you think about like having a goals of care conversation, what do you feel like the goals of those conversations are? And you could even type in the chat. So what are the goals of care conversations in your mind? And there could be several potentially. Feel free to speak up or type into the chat. Yeah, determining patients' wishes, next steps, care planning, code status is commonly a part of it. Hear and learn what the patient wishes are. Yeah. Yeah. Understand what's important. Yeah, great. Yeah, seeing if veterans and their families are on the same page, making sure that they understand their condition. Yeah. Yeah, these are all great. I think that I would add, kind of the central goal, the end result that we're hoping for is that the plan of care, the medical plan of care, as much as possible matches the veteran's goals and values. So really matching the plan of care to the goals and values. Um, and that's a different way of saying, what others have said here. I would also add that a lot of times when we bring up goals of care and values of care, veterans will and family members will bring up things that they are grieving, losses that they've already experienced, or losses that they anticipate experience. So anticipatory grief. Um, you know, having a serious illness threatens a lot of the things that people value. And so just being mindful of that as we're working towards a plan that matches the patient's goals and values, that inevitably, and you already know this, things that people are grieving may come up. So, I do a lot of teaching with medical students, residents, and fellows. And I'm just going to share my screen here to show you a kind of a talking map for having goals of care conversations that I've found very helpful and that I think could be adapted to various work. I think it applies to hospice type situations. I think that's the other thing. Sometimes I think people in the hospital think, oh, you have a goals of care conversation, you conclude hospice, they go on hospice, and goals of care have kind of been determined. And what we know is that these are iterative conversations that really occur until the end of life. Goals and values tend to evolve as a person goes through their end of life. So they're really iterative conversations throughout the patient's serious illness. So this remap, talking map for having goals of care conversations can be really helpful. This was developed by a group of medical educators that work with that throughout the country that work with a not-for-profit called Vital Talk. I think I've got their name here at the bottom here. They've got a nice website, and they've also got an app that's free to download that for anybody that's interested in tips for having better conversations about goals of care and other topics. They've got a lot of resources on that app, so I can't recommend that enough. Disclaimer, I have done some work with them to teach educators throughout the country on how to do this type of teaching using like simulated patients. And so I've received a small stipend occasionally for doing that work. But I find this really helpful in my practice. In my mind, I am constantly thinking about these different steps. So I think someone mentioned with a goals of care conversation, you absolutely want to make sure that people are on the same page with you about what their condition is. The way that I think of this is like if I think about going for a bike ride this weekend and I get all prepped up and everything, and that's my goal for the weekend, and I don't look at the weather forecast, and then it's going to be thunderstorming all weekend, that'll completely reframe what my goals are for the weekend. I'm going to think about doing something else most likely. So it's the same with the serious illness. You can't talk about what your goals and values are unless you have some understanding of what's going on. Now, this doesn't mean that a person has to know exactly what their prognosis is or anything like that. People vary in how much information they want about prognosis, but to at least have some shared understanding. And so I think everyone on this call, regardless of what your role is, can ask the veteran, what have you been told about your illness, about what to expect? What have the oncologists said? What did the palliative care team say at the hospital? What's your understanding? And they may not have the perfect understanding, but if they've at least got some understanding that they told me that they don't have any other treatments to treat this cancer, and that I might not have that long. That having a big picture understanding like that is perfect. Now, sometimes people don't have that understanding, or sometimes people are, have avoidance of talking about that type of thing, or may talk about it kind of indirectly. So I think that based on your clinical role, I think that you could offer more education, offer to, to maybe ask permission, hey, Mr. Smith, you've got a lot of the details, and I appreciate you sharing with me what your understanding is. Would it be okay? You can ask permission. Would it be okay if I shared some additional details? I think that asking for permission is really important. It kind of signposts the conversation, and people will by and large be ready to hear what you have to say, but it kind of gives them some sense that new information is coming. Now, if you don't feel like that's appropriate for your role, that's okay. But I think you can make a mental note and get to another team member who may be able to provide that information or have more of a conversation, if possible. And I think that even the key point here is that even if a person knows very well what they've been told before, when you get into this territory of talking about how seriously ill a person is, you can expect that there's going to be some emotion, and be prepared to respond to that. So whether you're giving new information or not, just being prepared to respond to that emotion. And there are many different ways of responding to the emotion. People, and this can come out in various forms. Sometimes people will say, oh, those doctors, they were so pessimistic, and they thought that, I was, that I don't have long to live, but I'm going to show them. And that's okay. That's just I think the person that says that, they've heard what the doctor has said about their condition, and they're struggling with it. They're grappling with it. They're struggling to adjust to the information. And so I don't think you need to feel, I tend to avoid feeling the need to over explain in that circumstance. Doctors do this all the time. We tend to over explain a situation, and maybe even become a little bit defensive and say, well, what my colleague meant was this, and they're just trying to make sure that you're up to date. No, I would respond to the emotion there. They're saying, that doctor was so pessimistic. I can't believe that they would think that, I'm going to show them. And, I think that's a time to pause and use one of these nurse strategies here. Funny story about the person the physician that developed this mnemonic for responding empathically. They were actually, it's an academic palliative care physician, and he was trying to come up with something that spelled doctor, and he couldn't. So he developed this instead, and these are different strategies. So I might say, Mr. Jones, you've served your country. You've been such a strong man throughout your life. I admire your resolve. I can only imagine what it was like to hear that from the doctor, and kind of validate and state an understanding of the response. So these aren't meant to all be used at once. I would think of them as playing cards. You can use one at a time. You could say, that must have been really scary to hear, that must have prompted some fear to hear that. That might be another way that you could approach that, or explore it a little bit more and say, wow, what was that like to have that doctor to say that? I can imagine, tell me more of what that was like. And so, people that have social workers are awesome at these types of skills, and I think it's more a part of training for some disciplines than others, and so it may come more inherently. But for others, who come from a clinical background, I think we know that people have not commonly received training in this. So just, keep that in mind as you're having these conversations. And only when you've been able, I generally, okay, so you've had some discussion about that. And maybe the veteran says, in response to you ask them and then they say, well, I know that I might die, sometime soon, but I just hope that, I can, beat the odds and live longer than what they expect. I think you can completely align with that hope and say, I hope for that too. And I think that that's a that can be a nice segue, to really opening up the conversation and asking what their goals and values are. And sometimes what I encourage physicians and others to do is we always tend to skip to the plan. And you really have to kind of force yourself to pause here. What I would say is, if you're talking to someone like about hospice, it's really tempting to try to talk about all the wonderful things that hospice can do. But if you can pause and say something like, and map the goals and values, and what I mean by that is really just exploring what's most important to them, you can set yourself up for success in talking about the plan, and say, hey, Mr. Jones, I know that you're really hoping to beat the odds here. And I know that you've also said that that time may be shorter than what anybody would want for you. If time is shorter, can you tell me what matters the most to you in the time that you have left? And just get them talking. There are several different ways of mapping goals and values. I'm going to kind of skip around here a little bit. You could ask about hopes, fears. Are there things that they would want to avoid? And sometimes just digging a little bit deeper. What else matters to you? And this is a time when, people, commonly with the veterans, people will say, I want to make sure that my family's taken care of. And they'll bring up something like the benefits issue. And it's a perfect time to hear what's on their mind with regard to that. And so, a lot of times, I'm thinking about a conversation where you're talking to a veteran about the potential for hospice. A lot of times people will say, I want to be at home and with my family. I don't want to suffer. And I still, the last hospitalization wasn't that horrible. I might want to be able to go back to the hospital if there's something that they could easily fix. They may or may not bring that up. A lot of times when you're having these types of open-ended questions, it's amazing what people will bring up. I've got a grandkid who's graduating from Purdue next month, and I want to make sure that I'm there for them. And really, this is just leaning into this part of the conversation. You all know this already, but I guess what I'm encouraging you to do is to really lean into this, and get some different ways that some things that they are hoping for. And if you ask for things that they want to avoid, sometimes people will come out and say, I am done with the hospital. I don't want to have to go back to the hospital. I've had people before who are still full code who will just volunteer, well, I don't want to be on life support. Now, I don't expect them necessarily to bring this up. They may say something that's completely different. They may say, I don't know, I want to avoid my sister. And that's okay. If they say something like that, it's an important social piece. You can say, oh, why is that? And explore that a little bit more. Now, sometimes people will bring things up that are unrealistic here, like, oh, I'm just hoping for a miracle. And once again, I would lean into that and maybe explore it. Say, what would a miracle look like? Just go with them and see where they go. And, a lot of times when people bring up things like miracles, we only think about miracles when our backs are kind of against the wall and we know that we need something that's a long shot. And so, just explore it. And, and I would even maybe say, I would love to see that happen, and then you can maybe say, what if what if we don't see that miracle? Or there are other things that you might hope for, even if that doesn't happen? And you can kind of finesse the conversation a little bit that way and get them talking about something that's more realistic. And once again, you're going to identify things that they're maybe having grief over. Okay. So what is this align here? Align is what we're referring to here is a communication strategy. This is basically reflecting back to the veteran or like the family member or patient what you've heard them say that they value, um, and really you're demonstrating active listening here. And even if it's something that that can't be accomplished, you're telling them that you've heard what they have to say. um, Mr. Jones, when I listen to you, what I've heard you say is that you want to be at home. You want to try to go fishing a couple bit more times. You want to make sure that your family's taken care of, and you've got some work to do there to explore what benefits you have through the VA. And you want to make sure that you avoid being in more pain. And I think of this as a separate step before you talk about any plan, because it takes out some of the noise that can sometimes come in when talking about the plan. What I mean by that is we know that for a lot of people, hospice is a loaded word. Um, and so if you can really demonstrate that you understand where they're coming from and what their goals and values are, then you can maybe suggest and say, would it be, once again, make an invitation? Would it be okay if I shared with you some things that I think we could do to help you out with some of these things that are really important to you? And you know, then it'll make more sense. Whatever you're bringing up, hey, with this particular issue, this is something that hospice could really help out with. I think that we might consider, talking about that some more, and seeing if that'd be a resource that you'd be interested in. And it doesn't take away all the static with talking about some of those things. They could still bring up concerns, and you explore it and see what's on their mind. So that's kind of an overview. This is, kind of a step-by-step process. It doesn't all have to happen in one conversation. And sometimes I find myself kind of jumping back to an earlier part. There's certainly emotion all throughout the conversation. So just remembering to empathize all the way through. And sometimes people, as we get closer, maybe they've said at the beginning, I know that, this disease is eventually going to end my life. They may be able to acknowledge that when you ask what their understanding is, but then maybe after you've been talking, maybe I've had people before when I align and say, you want to make sure that you're able to go fishing later this summer and spend time with your grandkids. That may be the time when the veteran says, Doc, how much time do you think I might have to actually do these things? I'll sometimes offer that when I'm reframing, but not always. So sometimes people will bring it up, and I go back and do a little bit more reframing and saying, hey, I think that you may have weeks to some months to be able to do that. So let's see, there was one other thing that I wanted to show here. Let's see if I can share one more slide here, one more screen. If I can get the teams to play friendly with me here. Oh, okay. So yeah, this is another, just when thinking about mapping goals and values, these are some specific strategies that can be helpful. This is actually another mnemonic, values. So knowing this values and importance of knowing this news, what's most important to you, what activities do you enjoy? These are things that, I'm sure that all of you ask people about, but if time were short, what would you want life to look like? You know, if you were to get to the end, where do you want to be in those hours and days right at the end? You know, would you prefer to be at home, or would you prefer to be somewhere else? Uncertainties, maybe past experiences with illness. Sometimes our values and goals oftentimes are heavily influenced by what we've seen other people go through or what we've been through ourselves. And then this last question, what do you anticipate will give you strength? What are some sources of strength? So that's another mnemonic here. So that is kind of a high level overview of how I think about goals of care conversations. It's 11:27. Yes, I'm just looking at the chat here. Vital Talk, yes, thank you. vitaltalk.org, or if you look up on your phone, you can see that app. Thank you, Meg. Appreciate that. Any questions or comments?
I'll just say you referenced that you had a diverse audience today, but I don't know if you even realized how diverse. We've got home care agencies, nursing home, hospice staff, outside hospitals, and volunteers. Like we've got everyone from all different settings that might be intersecting with a veteran during their journey. And I really appreciate you coming and talking about this today, because I think goals of care conversations have to happen at along every step of the way. So
Yeah,
I
that's
think
right. This is very much relates. If you've ever heard of like motivational interviewing throughout healthcare, this is one form of motivational interviewing is goals of care conversations. That's basically underlying kind of principles. So you can apply this to even non-palliative care hospice type conversations in many ways. Thank you.
Well, thank you for being gracious enough to give this presentation while you're staffing inpatient. We appreciate it. If folks have other topics that they'd like to hear from Dr. Fettig on, specific topics or presentations, please drop those in the chat. Like he said, he can come back at a future date and share more. I just want to remind everybody to please think about joining us as a partner. Thank you for being here today. Think about joining us at the Veterans House on July 2nd. We will send out copies of today's presentation. And Dr. Fettig, can we share your handout as well?
Sure. Yeah, I'll be
Okay.
happy to email it later.
Okay. Great. And I will hang out for a few minutes in case anybody has any follow-up questions or concerns about anything we talked about today. Thanks, everybody.
Hey, Elizabeth, I had a